We will move now to our first case study. So this one is by Dr. Bolu Eso, who studied veterinary medicine at the University of Budapest and qualified in 2019. Bolu specialises in small animal medicine and works at a practice in London. So Chloe, if you could play the video and we'll have a chat about it afterwards.
Hi, I'm Dr. Bolu Eso. I'm currently a small animal practicing vet in Walthamstow, North London, and I wanted to give you a little bit of a euthanasia scenario. So, an 11-year-old Bouvier de Flange, large breed dog, 58 kg, had presented as an emergency, presented collapsed. Now, the backstory of this Bouvier de Flange is that the history, he had arthritis, ongoing arthritis for the past 6 to 8 months. It hadn't been improving with Metacam. Also had regular kidney tests because with the Metacam as a non-steroidal anti-inflammatory, it affects the kidneys, and having regular kidney tests, it showed that the kidney parameters were getting worse. The owner was given the option of moving away from the non-steroidal anti-inflammatories and moving on to opioid treatment, but the owner wasn't happy with the opioid response. And so we tend to go back onto the Metacam. Ideally, we didn't want to go back onto the Metacam. The owner was informed of this and informed of the side effects of the Metacam, but still wanted to go on because the dog is 11 years old, has severe arthritis. The owner just wanted to keep them out of pain and keep the quality of life high. So that continued for a further 2 to 3 months or so. The dog was doing fine, but then the owner called up as an emergency in the afternoon saying that the dog had collapsed. So at this point, the owners brought the pet down. We had to carry the pet into the practice. I performed a physical exam. The dog's not looking great. On physical palpation and an orthopedic examination, there's crepitus in all joints. So all the small joints were popping. And on discussion with the owner, I advised that we should probably sedate him to take some x-rays. And on processing the x-rays, we were able to see that the bone had serious degenerative changes. There was serious degenerative changes in the joint of the elbow. The bone was barely recognizable. It was mottled. It had undergone regression, and it was highly inflamed in the joint as well. And visible on both limbs were pathological fractures through the condylar region of the humerus, but also the olecranon as well. So at this point, I had to have the discussion with the owner that the dog is not looking great. The prognosis isn't looking great either because of the fact that there are 2 fractures in both elbows. With this, I offered the owner the option that ideally in a healthy bone, we would recommend surgery and referral for surgery. We also haven't taken any x-rays of the hind limbs, so we don't know how bad the hind limbs are, but at this stage, it's very likely that the dog's going to have to be euthanized. And for the owner, this wasn't an option. So for her, she didn't accept my suggestion for euthanasia. So at this point, she asked for a second opinion from one of my colleagues. So I managed to get one of my more senior colleagues to come in and take over the case. And at this point, I handed over the case to my senior colleague. My colleague took over the case. I didn't hear much. And then I found out that my colleague had actually sent the client home with the dog. And when I came back and discussed with my colleague said that they'd given them antibiotics on top of extra pain relief to give, opioid pain relief to give at home, tableted version, so the gabapentin, again, to give at home. For me, this was a little bit confusing. I didn't quite understand it fully, but my colleague said that the x-rays resembled osteomyelitis, so bacterial infection of the bone. And so she started them on antibiotics, and it came to about 5 days after I'd initially seen the patient in which the owner had come back to the practice to have the pet put to sleep. And this was a process of reflection for me because it was something where I had suggested to an owner that they needed to euthanize their sick pet, and they didn't agree. And they didn't feel that my opinion was valid at that time, and they felt that there was more that could be done, which is why they asked for a second opinion. And on reflection, I always say that it's still absolutely valid for an owner to have a second opinion. It doesn't affect me negatively. It doesn't reflect on me negatively. It doesn't reflect on my clinical judgment. But owners are completely entitled to have a second opinion. Discussing euthanasia can be extremely difficult, mainly because in vet school, you're not directly taught how to discuss the quality of life, how to have that conversation one-on-one with an owner, and how to tell them that they may have to part ways with a family member, or that their pet is too sick to go on, or at this point, you strongly recommend that the pet needs to be euthanized. And so learning that becomes a skill in itself, because you have to learn where to push and pull in the discussion, how to present your case, and also how to explain to the owner and show the owner that their animal might not necessarily go on, and it's the best thing for them at that moment in time to put their animal to sleep. And it's an extremely difficult conversation to have.
So what did everyone think about that scenario? Did that ring any bells with anyone? Has anyone been in that kind of scenario? I think it's probably quite a familiar one for some of you. It's one of those situations where it kind of demonstrates the importance of, yeah, it definitely hits close. Is a comment in the chat. Absolutely. It's something that I think we hear a lot, either this situation or the reverse, which is the animal's healthy and they're asking me to put it to sleep. What shall I do? I don't think that's the right thing to do. It's a really difficult one to navigate. I think in this one scenario, it was obviously key to give the owner time to come to terms with this decision. It's never easy. And I wondered what you thought about Bolu's comment at the end there about they don't teach you those skills in vet school, about kind of having those discussions, those difficult kind of empathetic discussions that are never easy. Is that something that lots of you feel? Comment in the chat says, I went to the same vet school as he did, and I agree. But it's something we hear from graduates of, across the board from vet schools, that you are taught the kind of science of veterinary medicine and the softer skills that you need when you're in practice are something that are not so much part of the curriculum. So what do you think about, are there situations where you can put, in terms of the code, are there situations where you can put animals to sleep without consent? You can put it in the chat or you can just say, but do you think there are ever any times when you can put an animal to sleep without consent? Okay, well, we'll come on to those kinds of later. So if we just move, so yes, so one says yes, and another says, Mari says, I believe so, but perhaps not in this case. Yeah, I think that's probably right. So if we work through to the code, so the code that's relevant, I think, here to Bolu's case is that, of course, veterinary surgeons must make animal health and welfare their first consideration when attending to animals. That's clear. That's at the, that's at the basis of what you do. Veterinary surgeons must communicate effectively with clients, including in written and spoken English, and ensure informed consent is obtained before treatments and procedures are carried out. So that's to do with kind of communication consent. That's what we are kind of dealing with in this situation. In terms of euthanasia itself and the specifics, there is an entire chapter in the supporting guidance dedicated to euthanasia. So for those of you who are not yet in practice, and actually for those of you who haven't read it, please do, particularly if you're going into small animal practice, please do have a look at chapter 8 of the supporting guidance, because it has a huge amount of discussion about what you can do when you are in the kind of situation that Bolu is, or in the reverse, as we discussed, and lots of information about how you can deal with the difficulties of that kind of scenario. So it goes through the definition and the purpose of euthanasia, do where a client wants to put a healthy animal to sleep and you don't agree, what to do if euthanasia is in the best interest of the animal but the client doesn't agree. It also talks about kind of more specific issues like destruction of dangerous dogs and destruction of injured racehorses. But the thing to remember, of course, is that every situation is unique and it will be a matter for your judgment depending on the circumstances. But our guidance is there as a tool to help guide you through that decision. Of course, you can always call the advice line, or you can send an email if it's something that's not as urgent, and we'll try to give you as much help as we can if you're in a difficult situation. So part 2 of the supporting guidance, so still on chapter 8, I think this is applicable to Bolu's situation. So where you are concerned about an owner's refusal to consent to euthanasia, you can only advise your clients in accordance with your professional judgment. Where you are concerned that an animal's welfare is compromised because of an owner's refusal to allow euthanasia, you may take steps to resolve the situation. For example, an initial step could be to seek another veterinary opinion for a client, and potentially by telephone. So that's something practical that you can do where you feel like you're not getting anywhere. You're having this discussion, you're explaining your reasons, but the client is just not understanding or not willing to engage in those discussions or consent to the treatment. One thing you can do is, let me speak to a colleague, I'll get you a second opinion and see whether there's anything else we can do, or whether they agree with this course of action. That's kind of a practical way that you get the conversation along. In extreme circumstances, so I'm now moving on to the question I asked earlier about whether you can actually ever put an animal to sleep without the consent of the owner. This is all about, again, a very extreme situation, but under the Animal Welfare Act, if you are responsible for an animal and you cause that animal to suffer unnecessarily, it can be a criminal offence. So that's how animal owners must not obviously subject their animals to unnecessary suffering. And when an animal is in an inpatient of a veterinary practice, then a veterinary surgeon becomes a responsible person. So in those circumstances, if in your opinion the animal's condition is such that it should in its own interest be destroyed without delay, you may need to act without the owner's consent in putting the animal to sleep. You should make a full record of all the circumstances supporting your decision in case of any subsequent challenge, and you should discuss this with the owner of the animal before you make such a decision. And you should get another veterinary surgeon who is not directly involved to endorse your decision, so that you've got some backup there should anything come of it. But in those extreme circumstances, yes, you can. But as I say, this is very much last resort and extreme, and it's all in chapter 8 if you want to have more of a look at the kind of the guidance all around euthanasia.